The commonest question I get asked by my breast reduction patients, other than scarring, is whether they can feed their children once they give birth. Now, when we do a breast reduction surgery, as a plastic surgeon, I preserve 4 centimeters of tissue under the nipple areolar complex. So when I preserve this tissue, there's a high percentage of chance that these patients will breastfeed. And I've been doing breast reductions for the last 25 years, and some of my patients who have conceived, who have given birth, they come and give me a follow-up saying that they have successfully breastfed their children. So we are very confident that most of our patients, because of our techniques, they are able to breastfeed their children. The question is whether breast reduction surgery is going to be covered under insurance or not. A lot of countries in the West, they cover breast reduction surgery because of the problems that a large breast poses. They have spine problems, they have problems with the skin, they have breathing discomfort. So all this is got to do with the function. So it is covered by insurance companies. But in India, we are not really covering huge breast reductions with insurance. But if there is a patient who has giant breasts and she has lumps, especially in the area where we're doing the reduction, these lumps can get covered, and because of the lump removal, that gets covered under insurance. So this is one possible way where breast reduction can be covered under insurance. Scarring in breast reduction surgery. A few decades back, it was extensive. It was something like an anchor. You have the horizontal incision and you have the vertical incision, and this is something which most patients did not like. Now with the latest techniques, what I do in my patients is I give them a vertical incision, which is something becoming like an S. So it's like a J-shaped incision. And when the patient is actually in front of the mirror or looks at herself in the mirror, what you can see is just a 2 centimeter vertical, which is the vertical scar. The scar around the areola is practically not visible. So modern day breast reduction surgery, the scarring is minimal. I call it a J-shaped scar, and that's what you get after breast reduction, contrary to what you actually assume that breast reduction surgery comes with a lot of scarring.